Good afternoon. Welcome to our Tuesday press briefing at 2 o'clock with regards to COVID-19. I will be joined soon by Dr. Gail Burstein of our Department of Health, and of course Kendra Schmidt from Deaf Access Services is here to provide you the American Sign Language. Thank you for joining us today. We have a lot to go over, including about the vaccine clinic issues. But first, as of January 17th, that 51,248 COVID-19 cases have been reported in Erie County. In the last few days, we actually went over the 50,000 mark in confirmed COVID cases. The 7-day positivity rate has dropped to 5.7%. That's good. We want to continue to see that drop, although there are still hundreds of new COVID cases that are being identified on a daily basis. Sadly, I have to report that as of January 14th, there are 1,393 confirmed deaths with COVID-19 in Erie County, 120 deaths alone in the month of January. These are not numbers as we've talked about in the past. These are parents, these are grandparents, these are sisters and brothers, and in quite a number of occasions, they're also children. And I do know that there are 2 deaths under the age of 40 just in the month of January alone. On January 17th, in our area hospitals, there were 504 COVID-19 patients in Western New York hospitals, 88 in the ICU. 385 patients of those were in Erie County hospitals. 80 were in the ICU, 58 were on an airway assist. Unfortunately, 9 died in the hospital that day, and 33% of the patients were age 64 and under, so 1/3 of the patients were under what would be considered senior years. Diagnostic testing summary. You can see the numbers. We had the second highest new weekly case total last week, though our percentage dropped. There were 3,776 new cases confirmed last week. That's the second highest total after the prior week, which was 4,399. The new cases did decrease by about 15% from the previous week, and the weekly's positivity rate dropped 0.9%, almost a full percentage point. It's down to 5.9%, which is nearly the lowest we've had in quite some time. We want to continue to see that number go down. When we look at COVID cases for the last week by jurisdiction or zip code, not surprising to see some of the zip codes that have led in the past. Once again, leading, the number 1 zip code was 14221. Amherst-Williamsville Clarence with 216 new cases. Its 7-day rate on 100,000 population was 57.6. So if you had 100,000 population, a little less than 58 people would have been new COVID cases. Tonawanda is second, 14150. Lancaster, Hamburg, West Seneca. We've seen these for a couple months now. The City of Buffalo East Side, 14215, had an increase in cases. They were doing pretty good for the last few weeks, but we've seen an increase in cases. You will note, with regards to the new daily cases per 100,000 population, in general, these are better than what we've seen in prior weeks, in which we've seen a lot of 60s, 70s, and above. You will notice on this list you see nothing in the 100. That's good. So we have seen, in general, a reduction across the county. We want to continue to see that. Hospitalization, we did talk about this earlier. 67.3% of all hospital beds on January 17th were occupied in Erie County, so roughly 1/3 of the beds are available. 20% of COVID hospitalizations are in an ICU bed. Of course, not every bed that's in a hospital is occupied by a COVID patient, but we do want to continue to see the hospitalization numbers go down. Deaths, unfortunately, continue to accumulate, and in the last 7-day period, starting with the last day being January 17th, there are 57 people who have died as a result of COVID-19 in our area hospitals. So we are continuing to see a high rate of death or a high number of deaths associated with COVID-19 in our area hospitals. We said it all along. First come the cases, then come the hospitalizations, then come the deaths. We're starting to see the deaths associated with the higher hospitalizations of approximately 2 weeks ago. And we do expect to see those for the next week or so. And as our hospitalization number continues to drop, then we would hope to see a drop in the death numbers. And once again, looking at Erie County deaths by age group for the entire COVID-19 pandemic period of March 2020 to March 2021. As noted, there are 1,393 individuals who died from COVID-19 since the beginning of the pandemic in Erie County. 120 of them just in the month of January alone. We had a very bad month in December. It was the worst month of deaths overall. And right now, unfortunately, we're kind of headed on that same trajectory for January with 120 deaths through what would be the first 14 days of the month. So we may not make it up to the same death total as we did in December, but it's still going to be a bad number. And as I noted, 2 individuals have already died under the age of 40 during the month of January. 2 individuals have died between the ages of 40 to 49. While the vast majority of the deaths are in the senior category, we are losing individuals in the prime of their lives. These are the brothers and sisters, the children of individual. They are young parents in some situations. And we do offer our deepest condolences to the family members and loved ones from all who've lost an individual due to this terrible pandemic. Talk about response. We're going to go right into the vaccine delivery. I'm going to talk a little bit about it and then turn it over to Dr. Burstein. As most people know, we had to cancel the clinics for yesterday, today, and tomorrow in Erie County due to a lack of supply of COVID-19 vaccine. Erie County Department of Health has been receiving vaccine doses through New York State, which receives them from the federal government. We have received the Moderna vaccine. Hospitals and others in our area have also received the Pfizer vaccine. New York State controls what the locals get after they receive their shipment of vaccines from the federal government. And we saw a big drop for this week's allocated doses. We were at 7,500 doses last week. 2 weeks ago. Last week, we had approximately 5,500 doses available for us. This upcoming week, we received an allocation of 1,700 doses. Just to give you an example, there was one day last week where at 2 of our clinics, we vaccinated more than 1,700 people on just one day. So we are at the mercy of the allocation we receive. We have provided vaccine to 14,176 people since it started. These are all first doses, so these are all one individual. We do anticipate starting second dose vaccinations next week. We have been told we are going to receive a separate supply of doses for our second dose categories. So the individuals who received the vaccine previously will receive the vaccine going forward. But we are very worried about what we're going to be able to do for the remainder of the appointments that we have scheduled through the end of January. 3,700 appointments approximately were canceled for yesterday, today, and tomorrow. And we may have to cancel additional appointments scheduled through the end of January due to the reduction in our vaccine allocation. Now, a lot of people have asked, what does that mean if my appointment was canceled? Do I go to the end of the line and now I'm not going to get a vaccine until April or June? People with canceled appointments will be offered slots at future Erie County Department of Health sites. Erie County presently has no appointments scheduled for the month of February and beyond. When it looked like we were going to get our reduced allocation, rather than open up appointments at our Erie County Department of Health vaccine slots, we didn't open any. So we're going to prioritize those who had vaccination appointments canceled. We will attempt to vaccinate those individuals with their first dose in the early weeks of February. We are not going to schedule those until we know we have sufficient doses on hand. It would be silly for us to go ahead and schedule these individuals for early February at a location when we don't know if we're going to have the vaccine in hand. So once we get it on hand, we will then schedule with the individuals who had their appointments canceled a date that'll thereafter follow. You will probably not get a call until either the last day of the month or the early days of February to reschedule it. A robo-dial and emails went out canceling the appointments. We want people to understand we are not scheduling them for early February until we have the doses on hand. We do not want to go ahead and schedule them and then have to cancel them again because we didn't receive doses from New York State and New York State didn't receive them from the federal government. So rather than go through the whole system of scheduling these individuals and then potentially have to canceling them and rescheduling them in the future, we are going to do our best to get the doses on hand, and then for the individuals who had appointments canceled, prioritize them based on their first day. So Monday, yesterday's would be prioritized as the first day. Today's will be prioritized as the second day, and so on, and those individuals will receive them in February. With that, I'm going to turn it over to Dr. Burstein to talk a little bit more about vaccines and, truthfully, anything else she wants to.
Ow.
Go ahead, Doctor.
Thank you. Good afternoon. So I just want to reiterate what the county executive has told us, that, unfortunately, we were forced to cancel vaccine appointments this week, and we may be forced to cancel vaccine appointments for next week too if we don't receive the allocated doses that we have requested from the state, because they haven't received the doses that they had requested from the federal government. So I just want to remind everybody that not everybody is eligible for vaccination right now. We are still prioritizing Phase 1A and Phase 1B. We will not be able to make appointments, and no facility will be able to make appointments for people who do not meet those criteria. So we know that there are other agencies in our community that are offering vaccine right now. We know that pharmacies are up and running, and they're vaccinating people who are 65 and older, and they are only immunizing people that are 65 and older. So if you're in 1B category and you're younger, say in your 20s, 30s, 40s, or even 50s, you will not be able to get an appointment with the pharmacy. Also, the pharmacy is only scheduling appointments by phone, and so you will have to call them. There is no online opportunity to get those appointments through the pharmacy. Also, the New York State Health Department has opened up a vaccine clinic at UB at Harriman Hall at the UB South Campus, and they are immunizing people in the 1A and the 1B categories. So remember, appointments are required at all sites. I know that all the sites will turn people away. Pharmacies are turning people away. I know that in our facilities, when we have vaccine, we are going to turn people away. They don't have appointments, and UB is turning people away from the state site if you do not have an appointment. Also, if you're under quarantine or isolation, you should be at home. You should not be coming to a vaccine site to get immunized. We want to keep everybody who is at the vaccine site healthy. They're coming to the site to protect themselves against COVID-19. They do not want to be exposed. So please stay at home and wait your turn. There will be an opportunity. Also, Erie County Health Department is not scheduling vaccine appointments. If you call our 2929 number, there is an option, number 4, for vaccine information. We say very clearly, we are not scheduling appointments now. As the county executive said, we will not be able to schedule appointments probably until February for those people who we had to cancel, and then everybody else is beyond that, and we don't really know when. Also, if you do have a vaccine appointment, you're lucky enough it hasn't been scheduled, or you were able to make it somewhere else, you need valid ID to prove that you are in the 1A or the 1B category. So, and you have to have proof that you actually do have an appointment. So please bring your ticket or your confirmation on your phone. Also, if you're for a senior, 65 and up, bring some valid ID that is a proof of your age. If you're in 1A or 1B because of your work situation, you need some type of documentation from your employer or your job ID. Demonstrate you are in that category. Remember, the vaccine will not be available for the general population for months. We don't even know when, because we have so many people in 1A and 1B, including in Erie County, that we have to get through before we can offer it to other people. And remember, we are offering it to people in 1A and 1B categories because those are the people that are most at risk. They're either, because of their jobs, most at risk of being exposed to COVID-19, like healthcare workers, or people are, our sanitarians, our police officers, our fire, or people who are most at risk for complications, like our elderly, our seniors 65 and over. So that's how those priorities are being chosen. Also, again, when we get past Phase 1A and 1B, that will be months in advance. So if you're not in any of those categories, please don't expect to be able to get an appointment for a vaccine until months from now, maybe the late spring, maybe the summer. Also, we have all the vaccinators have been directed about which populations to vaccinate. So county governments, local health departments throughout New York State we've been directed to vaccinate essential government workers first, whereas the pharmacies have been designated to vaccinate people who are 65 and up. And also when primary care does eventually get the vaccine, they will also be immunizing people who are 65 and up. So everybody has their lane, and we're trying very hard to stick to it. So, people have been calling our Erie County Health Department hotline asking, well, hey, I've received 1 dose of vaccine or maybe 2 doses of vaccine. What happens if I've been exposed? Do I have to be in quarantine? Or what happens when I travel? Do I still have to be in, test and have to remain in quarantine when I return? The answer is yes to both of those. So far, New York State Health Department has not issued any different guidance for people in quarantine, either through exposure or travel, because of their immunization status. And also, we know that just getting vaccinated alone is not 100% protective. First of all, it takes a while, at least 2 weeks, after your second dose of the Moderna or Pfizer vaccine to develop protective immunity. After 1 dose, it's going to give some protection maybe, but it's not going to cut it. And also, we don't know, because of the trials have not been conducted to see if it actually prevents infection. So we still are strongly recommending that whatever you do, you continue to wear a mask, stay at home if you don't feel well, even if you have been immunized. Try to keep your social distancing intact and wash your hands. So the good news is this isn't all bad news. I want to share some good news. So Pfizer and Moderna companies, they both have announced that they are planning to really rev up their production for the United States, and they are planning to produce 200 million vaccine doses by the end of 2021. So, by the end of July 2021. So by the end of this summer, the U.S. will have 200 million vaccine doses to be able to administer to people like you, people like us in our community. So this U.S. supply of vaccine will increase. So that's the good news. However, until then, and there is going to be time until then, we still have to continue our preventive measures. We know that our non-pharmaceutical interventions work. We know that mask wearing when you're around other people who are outside your household prevents infection. We know that maintaining social distancing prevents infection. We know that minimizing indoor gatherings, outdoor gatherings are safer, but we know indoor gatherings, even if they're very small, people coming over, a friend or two who watch the Bill games, still can result in infection. Also, please stay at home when you're sick. I spoke with our nurses today that are calling people who have positive test results, and they are admitting that people are still going out when they're sick. They thought, oh, I just had a cold, or oh, I thought it was allergies. You don't know what it is in the days of COVID-19, so please stay home when you're sick. And once again, listen to your mother, wash your hands whenever you go out, and keep up all the other cleaning measures. And so now I'm going to turn it over to the county executive to announce a special event tonight.
Thank you, Dr. Burstein. As many people know, as part of the presidential inauguration ceremony, the Biden Presidential Inaugural Committee has asked at 5:30 tonight that governmental buildings, churches be lit up in a yellowish amber color to honor those who have died as a result of the COVID-19 pandemic. Nearly 400,000 of our fellow Americans have died in this past year. As we know, we have 1,393 confirmed deaths in Erie County. So we are all mourning the loss of these individuals. And today at 5:30, you will see as a picture of you have here, Old County Hall, which is lit up nice and bright and white, but it'll be lit up in a little amberish color today to honor the individuals. If you hear church bells ringing at 5:30, it's because of the churches participating. You have an opportunity to participate at home. They've asked everyone to light a candle, turn on your porch light, in honor of the individuals who unfortunately have perished. Light a candle, put it in your window. Of course, be safe. Make sure there's no drapes around it. We don't want you to start a fire. But we are participating in this program, just like everyone else across the country, to honor and mourn the loss of those in our community who were with us at this time last year, but are not due to this terrible pandemic. and that is 5:30 tonight. I want to go and talk a little bit about the business climate and environment. We've had a lot of programs over the last few years. It feels like years. It's been months, but it feels like years, to help our local economy. And of course, the Back to Business program is something that we're very instrumental working on, Erie County government, with many of our partners in the business community as well as elsewhere. The ECIDA has a COVID impact loan program. We want to stress this again. Not every business who is eligible has applied for it, but you must be a for-profit and have fewer than 50 employees. You can get a loan of up to $250,000. These are low-interest loans at 1%. You're not going to find a loan elsewhere at an amount this low. There are no payments for 1 year, and then interest-only payments for year 2. If you are interested as a business, a small business that resides in Erie County, please call 856-6525, extension 219, to talk it over with the Erie County Industrial Development Agency. This COVID impact loan program is available for quite a number of your costs associated with your business. We want business to understand that we're here to help. So the COVID impact loan program is still going. New York State has announced the New York State Bar Restaurant Recovery Fund, including up to $3 million in reimbursable grants for up to $5,000 to eligible businesses. Grants to reimburse businesses are for improvements made or equipment purchased due to COVID-19. We've done something similar locally already with a local business community. New York State's doing the same thing all. You have to be a full-service restaurant. You have no more than $3 million in revenue as of 2019. You can apply at the link on the page that you see on the screen, or for more information, you can go online to esd.ny.gov. The Paycheck Protection Program, an SBA loan that helps businesses keep their workforce employed during the coronavirus crisis, has resumed effective January 11th. The SBA is currently offering first draw PPP loans for first-time program participants and second draw for those who did it previously. SBA will forgive these loans if all employee retention criteria are met and the funds are used for eligible expenses. Interested businesses should contact their local lender. Don't call us at ECIDA, don't call us at Erie County. Call your bank, call your local lender. And for more information, you can get that at sba.gov. The Shop 716 e-gift card is still available for purchase if you want to give it as a gift. If you got someone's birthday coming up, you can buy the Shop 716 e-gift card. Over 740 participating businesses. We've sold over 30,500 businesses for a total, 30,500 cards for a total of $1 million going back to our small businesses, and they're still available for sale. If you got a gift card for a Christmas present, a holiday present, go ahead and use it now. Support our local businesses. And if you got another birthday, another gift you want to give to someone, you can give them a gift card too. And one of 740 local businesses will be very happy when those individuals redeem it at their business. We will open it up to questions at this time. I just want to note, before we open it up to questions, that we are all very excited about our Bills in the AFC Championship game against the Chiefs. I'm very excited. We last week won a bet against Johnny Olszewski, the county executive from Baltimore County, Maryland. We'll be getting some crab cakes and a local brew from Baltimore County locally. Going to probably try to set up that bet with our friends from Kansas City. I do want to remind everybody that we are still in a COVID-19 crisis, so please be smart when you're celebrating these victories. We know that there were mass gatherings after the victory on Saturday night. And we want to remind everybody that COVID's still out there. You go out, wear a mask, try to eliminate being in contact with hundreds of other individuals. We certainly are rooting on the team. We want them to defeat the Chiefs. We want to get back to the Super Bowl. I remember what it was like in the Super Bowl years, and as we're all finding out, for those who don't remember, the town gets excited, and rightly so. But you got to remember, COVID-19 is still out there. I do know that there were a number of individuals who, about 1% or so, who applied for tickets for the game against the Raven and did not get it because they were COVID-19 positive. So let's try to be as smart as we possibly can out there, understanding that asymptomatic transmission exists, that an individual doesn't have to show any symptoms and have COVID-19 and pass it on to others. So as we're watching the game this weekend, Sunday at 6 o'clock, let's just remember that we shouldn't gather in these huge settings because we put ourselves at risk for COVID-19 transmission. And the last thing any of us want to do is, if the Bills make it to the Super Bowl, is get so sick that we can't watch the Super Bowl game because we're suffering from COVID-19. And with that, I will open it up to questions, and we will start with WBEN Radio, Mike Baggerman.
Hey, Mark, I know last week you were talking about wanting to get Erie County out of the orange zone cluster status, and I know there's been some developments, especially late last week, but I'm just wondering the conversations you've been having with the state. Is there anything new that you can say about the conversations you've been having about getting us out of the cluster zone?
I've had multiple conversations. I truly thought we'd be in at least the yellow zone by this point. I reiterate what I've said before. We should be treated fairly. We did deserve to go into cluster zone based on the statistics and the numbers that we saw when it was put in the orange. Unfortunately, many other areas of our state are now surpassing us with regards to hospitalizations as well as percentage positive, and they have not been put in the cluster zones. As I've continued to share with the governor and his staff, we should be treated fairly. And as of before I came out here today, I had not gotten any update as to whether or not they were going to change it, Michael, but I still stand by what I've said. We deserve to be treated fairly. If we're going to be in the orange, then for that matter, the rest of upstate New York should probably be in the orange. We should be moved down otherwise. Michael Desmond, WBFO.
Yeah, Mark, a couple of weeks ago you talked about state figures on what was going on in nursing homes because they won't tell you how many vaccinations there have been in nursing homes. Do you have any sense of how many of the residents in our local nursing homes have been vaccinated, and the people who care for them, traditionally of color and lower paid, have they also been vaccinated?
I have started getting some reports in the last week or so with regards to vaccination numbers at nursing homes. I believe they are just about complete with all the nursing homes. I think they have one more nursing home to do for the first round. I can confirm that not every nursing home patient has taken the vaccine, and neither has every employee. There are patients as well as employees who have declined the vaccine. They have the right to do that, though if we do not get to a certain percentage, we will have a difficult time dealing with this because we'll still have individuals who are sick. We will never reach herd immunity. So I can't give you the exact number, but as of last I've seen, there were 34 out of 35 nursing homes that had at least received their first dose, and they were moving to finish that with both their staff as well as their patients. Unfortunately, not every patient has accepted the dosage, and neither have all of the staff, and it varies. What I've heard is there are some nursing homes where the staff have accepted it or I should say approximately 10% have declined, and some more have declined as a greater percentage. I don't have the exact numbers here, but we have been getting updated totals, and they are close to finishing the first dose, at least in the nursing homes, but not every patient nor staff member has taken it. The Buffalo News, Sandra Tan.
Hi, Mark. In regard to the declining amount of vaccine that Erie County has been getting week over week, is this due to our region simply getting a lot less of the vaccine, or is this due to the fact that there are many more providers that are offering the vaccine, so the county share is so much more limited? And is that going to change?
I would go with the latter. I do know from my fellow county executive colleagues that they all were cut at about the same percentage. We did receive an update on the number of vaccines that were being distributed or planned to be distributed for the upcoming week across New York State, except for New York City. There were approximately 142,000 doses that were being allocated across all of New York State at all of the clinics. The one thing we have seen in the last week that we didn't see the week before is pharmacies are now part of the vaccination program and are planned on receiving vaccination doses, as well as the state-run clinics. It's my understanding the state-run clinic was going to get 3,900 doses for the Western New York UB clinic for the upcoming week. And pharmacies were receiving them. The most it seemed like any pharmacy was receiving was about 200 doses at a pharmacy. Most were receiving 100 doses for the entire week. So we have seen a dramatic reduction across the board with public health departments, hospitals, federally qualified health centers, and the like receiving less vaccine than they had in prior weeks. And it's because number one, there are more providers, so there's more that has to be distributed out, more parties that have to receive it. And two, the reduction in vaccines. It wasn't that long ago, New York State got 300,000 doses a week. This most recent week, they got 250,000 doses, of which it looks like about 100,000 of those went to New York City, 142,000 or so went to the rest of the state. And it's disappointing because we know what we're capable of doing. As I said, in one day last week, at two of our clinic sites, we did, I think, 1,705 doses in just one day. And we've been given 1,700 for the entire week. If we could get more doses, we would do more people. It's just a matter of supply, the number of providers, and the tremendous demand.
Do you have any insight as to why the state is getting less when the federal government said they would be releasing more, that they wouldn't be holding back vaccine for the second dose?
Well, it's already been reported widely, Sandy, that there is no second dose vaccine left. The state's not, Washington Post and others reported that there is no reserve. Secretary Azar came out and said they were releasing it, and then they realized there was no reserve. Dr. Fauci, I was watching him this weekend, in which he said that in the first few days they set a reserve aside, but then once they realized that they were going to be able to continue to get supply, they just started releasing everything. So there is no reserve. The federal government can't release any more than what it had because it had already released it. Erin Tai from Spectrum News.
Hi, Mark. Speaking of federal government, as we prepare for Inauguration Day and new administration, what's one message that you hope you can get through to Washington to help with the relief on COVID?
Well, President-elect Biden announced at the end of last week a COVID-19 plan for vaccinations as well as for our recovery of our economy. And it's a good plan. It's a plan that addresses additional aid for individuals, additional aid for businesses, as well as local government aid. If that plan passed at the numbers that were proposed by the Biden administration, or I should say President-elect Biden administration, Erie County would receive sufficient funds to help us cover the costs associated with COVID-19 response, testing, vaccinations, as well as address some of the shortfalls that we've had due to the revenue losses. So I just call on our elected representatives, Democrats and Republicans, to work together to get that passed ASAP. This is not a Democratic or Republican matter. This is an American matter. Sometime in the next day or so, we're going to cross over the threshold with 400,000 Americans having died from COVID-19 in less than a year. And very soon thereafter, we're going to cross over the threshold of more people dying from COVID-19 than did in all of World War II from the United States. I mean, these are just horribly sad numbers. And as we know, thousands and thousands of more are going to die in the next few weeks. So we need to be able to get the vaccine in the arms of people. We need to be able to address the growing concern out there with our economy. This is not a Democratic or a Republican issue. This is an issue of protecting the people of the United States of America and growing our economy and trying to get it to recover like it was before. So it doesn't matter if it's our two senators, Senator Schumer, who's going to be the majority leader, I believe, in a day and a half, Senator Gillibrand, or locally in Western New York, you have, of course, Congressman Higgins, Congressman Jacobs, Congressman Reed, and for that matter, some people in the viewing area can probably be represented by Congressman Morelli. And for that matter, our friends down in the parts of Pennsylvania, you need to talk to your congressional representatives. This is not a Democratic or Republican matter. Support this program. We are facing a once-in-a-lifetime global pandemic, once-in-a-century global pandemic. We need to think about how we're going to respond now. Not worry about debt issues 40 years down the line. WGRZ Channel 2, I think we have Kelly Dudzig and Dave McKinley.
Hi, are there any plans to maybe set up a hotline for people to be able to make appointments with the county, like Niagara County is using 211, and I know people are having problems getting through on the state hotline, and there are also people who don't have internet service, so I just am wondering if there's going to be some kind of hotline option Or what advice do you have for people who are having issues making an appointment? Not that there are appointments available with the county right now, but just for the future.
Well, our goal is, but unfortunately, the system is incapable of handling it right now. We know we've received more than 45,000 requests to be advised when clinics open up in the future through our form that exists on the website. We originally were told by New York State to schedule appointments out in advance. Now that we don't have the vaccine, and they've even told us, don't schedule appointments out in advance. We don't know what we're getting. So it makes no sense to have these schedules out in advance. I know New York State's doing it. I don't know if they're going to be able to meet their demand. But for us, we're not going to put a system in place that allows people to schedule appointments until we have the vaccine in hand. And I just do not want to go through what we've had to go through over the last few days, which is first making the determination that we had to cancel the appointments and then notify those individuals of the cancellation. It takes away too much time and effort from what we really need to be doing, which is directly responding to COVID-19.
Do you have any indication then, Mr. Executive, of the people that you've been vaccinating? Do you feel that there's a danger of them not being able to get the second dose that they're supposed to have, and that they might have to start from square one? Or
No, we have no indication of that. Dr. Burstein's nodding her head like this. Everything that we've indicated is that they are starting. What's going to happen, if anything, it might mean that there's a little bit less amount available for the zone ones, the first doses, because we've been told they are going to provide us a supply on a weekly basis as we need to meet the second dose criteria. So actually next week, we are anticipating receiving a certain number of doses to do our first group of individuals that the county vaccinated, and that was in conjunction with a clinic through Kaleida Health for Kaleida's employees. So we have been told repeatedly that we don't know what you're going to get in the future for first doses. That can change, but you will get second dose numbers based on what you need. And we'll hold the state to it. Simple as that. And you don't have to start from the beginning, is what the doctor said. WIVB, Channel 4, George Rickert. Are you there, George? Just make sure you're unmuted. Okay, go ahead.
Yeah, sorry for the delay. Regarding the two Bills games now done, did Erie County contact tracers ever become involved in that? I know they weren't originally supposed to, but I'm wondering if county contact tracers ever became involved in the contact tracing, and if not, have you heard any feedback from the state contact tracers about whether they determined anything in regard to whatever spread did or did not go on at the games?
I'll turn that over to Dr. Burstein.
Thank you. Hi. So far, the Erie County Health Department contact tracers have not been involved with the contact tracing related to the games, where the state worked with the Bills to make sure that everybody who had a ticket to get into the game was tested before they entered. So the state worked with BioReference Laboratory to ensure that the test results had a very quick turnaround time in 24 hours or less. And then the contact tracers, immediately started doing the notification, starting with the positives and doing the contact tracing with those individuals. So, what we know is good news, bad news. First of all, supposedly all those individuals that were tested were asymptomatic and had no prior knowledge that they could have been infected. So the number for the first game was about 2%, and I think for the second game was a little closer to 1.5%. And I know people think like, hey, that's good, the numbers were very small around asymptomatic people. However, the glass half empty, half full, that still means that there are people walking around Erie County that are feeling completely well enough to go to a Bills game and have no idea that they're infected. So I think that reinforces that people still have to keep up their guard hard and do the preventive measures like masking and social distancing and, again, staying home when they're sick. We have indirectly been involved with contact tracing because we have had people that got together for the Bills games and with small gatherings and become infected through that route. And so we've been doing the contact tracing for that. But we were not directly involved with the state's contact tracing through their testing for Bills game admissions. Thanks.
And WKBW Channel 7.
Yeah, good afternoon, everybody. The New York Times yesterday did a piece with various epidemiologists who believe that we as a country have sort of undersold the COVID-19 vaccine, perhaps unintentionally, by focusing too much on how it's not 100% effective and emphasizing that people's behavior should not change after getting the shot. So we were wondering, Dr. Bernstein, do you think that we've undersold the vaccine in any way and that this could be a problem for, public confidence in the vaccine?
Thank you. Thanks. Well, it's difficult for me to talk about the rest of the country. However, in Erie County, we are giving a strong message that everybody who is eligible for a vaccine should get vaccinated. And until that time, we still have to practice our preventive behaviors because not everybody knows when they're going to get the vaccine. So it's really a combination of everybody getting vaccinated, and we know there's a pretty high bar to be able to get herd immunity, so where we have enough people that are protected through vaccination in our community that there are not enough susceptible hosts for the infection to take hold in our community. So we're waiting for that to happen, and until that time, we have to take these preventive measures and reinforce these preventive measures. And 95% isn't 100%, and it's pretty good. So remember flu vaccine that we're also pushing all the time, and that effectiveness can range anywhere from the high 20s, low 30% to maybe the 50, 60% range. And, we still real strongly encourage people to get that vaccine. I think it's the same is true with COVID-19. It's even more efficacious than flu vaccine as far as our knowledge. And people really need to get immunized. However, you can't let down their guard and pretend that COVID-19 is still not here right now, because right now there are a lot of susceptible people in our community. Most people in our community have not received both doses. So I think the message has to be strong. Get vaccinated when you can, and until then, make sure that you practice protective behaviors. And even after you're vaccinated, until we reach herd immunity, everybody needs to practice these protective behaviors. It's not just one or the other. Thanks.
Just note, Dr. Bernstein said most people in our community have not received both doses. Most people in our community have not received a single dose. Very, very small percentage, probably less than 1% have received both doses at this point. You need both doses to have proper protection. And as we know, there's a tremendous demand in our community. Hundreds of thousands of people qualify for the first dose, and most have not received it yet. Anybody else I didn't identify? If not, we'll do one more round. WBEN, Mike Baggerman.
Aside from getting more supplies from New York State and from the federal government, do you think that there's anything that the state can do to help counties with the distribution of this vaccine process? We know they have a big hand in everything going on. What can they do to make your lives easier?
Well, they can just get us the vaccine. We are set. We have multiple freezers waiting to hold vaccines for extended periods. We have teams that are set. As we noted last week, when we talked, we had 2 clinics that were open, and we were hoping to open up a third this week so we could have 3 clinics running on every day, and we've had to cancel clinics because we don't have the vaccine. We have the staff, we have the technology, we have the capability to deliver thousands of doses on a weekly basis. We just need the doses. And that is in some ways out of the state's hands as well, because it depends on what they receive from the federal government. And we just need more doses. Simple as that. WBFO, Mike Desmond, any more questions?
Yeah, following up on what I asked before about the nursing homes, again, it's all the way through this, it's been people basically over 65. If you are able to vaccinate everybody in a nursing home, and then eventually start the second round, including patients and staff and so forth, are we going to see short-term fewer new cases and fewer seniors getting sick?
Well, I don't know if we're going to see newer cases necessarily drop, because the nursing home proportion makes a small percentage of all cases, but we would hopefully see a reduction in hospitalizations and deaths, because the nursing home population makes up a greater preponderance than other age groups of individuals in the hospital and death. So that's why it was so important to do them first, to get the individuals who are in nursing homes vaccinated. And if someone new is admitted to a nursing home, for them to get the vaccinations, because that's what's driving a good portion of our deaths. Not all of our deaths are individuals who reside in nursing homes. That is the case. But we do know a good portion of them are, so the sooner we can vaccinate all people, staff and patients at a nursing home, the greater the chance will be that we'll see not just a reduction in hospitalizations, but we'll see a reduction in deaths. And that's what it's all about, saving lives. Sandra, any more questions?
Yes, thanks. Just want to confirm again, as we speak, you still plan to have scheduled vaccination clinics Thursday and Friday of this week as well as next week, but then beyond that, you aren't scheduling any more? And there's a chance that the ones that you have scheduled for the remainder of this month could be canceled.
Yes.
And and then if you are vaccinating folks, if the counties are supposed to be focusing on governmental workers, can you elaborate on that a little more? Does that mean that if thousands of people sign up for these clinics, that there are certain folks who are going to jump to the front of the line?
Well, for the people who have had their vaccination appointments canceled, they'll be treated the same. Doesn't matter if it was the current ones that were canceled or if we have to cancel those in the future. We're not going to differentiate. If you had an appointment from Erie County, we're going to honor that appointment. But the state has told us that they want county health departments focusing on essential governmental workers, which include police, fire, workers associated with like our NFTA, our correctional facility, workers in county government that have direct contact and qualify, like our CPS workers. So while we've been told we can still vaccinate anybody who's in the 1A and 1B categories, they want us to prioritize that. And then the 65 and above are supposed to be prioritized by the pharmacies such that they will not take anybody other than 65 and above. There is a chance we will have to cancel the vaccination appointments we've scheduled for the remainder of this week. We were told we were going to get 1,700 doses. We were told they should arrive by Tuesday and Wednesday. We have not received notice yet that we normally get from the delivery service, which is UPS or FedEx, that they're going to be delivered. So it's possible that tomorrow we'll be announcing the cancellation of Thursday's clinics and so on. I really don't want to do it, but if I don't have vaccine, I can't vaccinate anybody. And as soon as we have a better idea, we will let the public know that yes, the Thursday clinics are on, the Friday clinics are on, or no, they're canceled. This is not the situation any of us want to be in. We want to vaccinate more people. We don't want to tell people that their appointments are canceled. We just got put in a really bad situation because of the lack of supply. Aaron Ty from Spectrum News, any more questions?
Yeah, this one is for Dr. Burstein. Right now, we've been using the Moderna and the Pfizer. If one of the ones, like the Johnson & Johnson, that's just a one-dose vaccine gets approved, what group of people would that best be used on?
Again, we rely on our vaccine supply from New York State. New York State also recommends who we are going to immunize. So we will have to wait to see if Johnson & Johnson is able to deliver some strong data to show that the one-dose vaccine is very effective. wait for the FDA to provide the emergency use authorization, and then wait for the New York State to get their supply, and then we will wait to see what New York State recommends, how we use those doses. So that is to be determined. Thanks.
I just want to note for the record, because I've seen a couple of things posted on social media that note otherwise, I have not received the first dose of the vaccine. I have not scheduled an appointment. I'm going to wait. As I've said before, it makes no sense for me to get it before my parents or others who qualify and are in high-risk categories. So if you see anything on social media saying Mark Poloncarz is lying, he got the vaccine, it is a lie. I have not. The only vaccine I got this year was my flu shot. WGRZ Channel 2.
Yes, one more thing from me, Mr. Executive, and thank you. We continually hear, we heard you say, I don't have the supply because it comes from the state, and the state is saying we're not getting it from the federal government. She swallowed the spider to catch the fly. Yet, the CDC, at its latest update, indicated that New York State had been shipped almost about 3 times the amount that it's actually used, which would tell me that someone's not being truthful. And I just wondered if you had any thoughts on that, and if you've asked about it. Why does New York State have 3 times the amount that it's administered, and what's the reason for that? What's the deal?
I can't explain, David. I know what we're doing locally. I know how our hospitals have been highly rated with regards to vaccinating and getting the doses that they've allocated out. One of the reasons why we had to cancel clinics is in prior weeks we had received transfer of doses from other locations. Last week we received about 1,200 doses from, we actually received 1,200 doses from Roswell Park Comprehensive Cancer Center and 100 doses from hospice. We've been scrounging around trying to get them, and everyone's out. So there's no additional doses that we could get from another location that might have them that we could then use. All I can talk about is what we're seeing here, and we have a few doses left over that we're going to put in people's arms this week. But we want to get that 1,700 in so we can get at least a full day and maybe 2 days worth of clinics in this week. I wish we had more. And this is one of those times where you can wish all you want, but until you actually get them, there's not a lot you can do.
Yeah. Have you had to throw any out?
No. Not a single drop has been wasted. One of the things that Erie County did early on that the state is now mandating every provider do is have a standby list. So you have all your appointments scheduled for today, but say you have to puncture one of the vaccine vials, which then means you got to use it in a very short period of time, and you only puncture it once. Now you have 9 and potentially 10 other doses. We've had a standby list of individuals who qualify who will then get called in the final hour to say, come down to where our clinic is and we will give you your dose. And as a result of that, we have not wasted a single drop of vaccine. All vaccine has gone into the arms of individuals. And I'm proud of our team for doing that. And such to the point that we did it right from the beginning, and now New York State is mandating it with every other vaccine provider. And when I saw that mandate came down, I chuckled a little bit saying, you don't have to worry about Erie County because we've already done it. We have a standby list. And as a result, we are ensuring that all drops, all doses go in the arms of individuals and are not wasted. And that's something we can be proud of because of the great team we have here. WIVB Channel 4, George Rickard, any more questions?
No more. Thank you, Mark.
Okay, and I think it's Jalot from Channel 7, any more questions?
No, I think we're all set.
Okay, thank you. If we get more information regarding the vaccines and what we can do for the remainder of this week, we certainly will immediately announce it so that people understand whether their appointment is going to go on or not. We want more. We want 2 more wins for our Bills. We want a big victory this week in Kansas City and then go back to the scene of the crime, so to speak, Tampa, for Super Bowl. But first we got to get through the AFC Championship. Certainly wishing everybody on the team good luck, good wishes. I know a lot of folks are talking about potentially going down to the game. Remember, if you go to the game, if you buy a ticket online, you go to the game, you're going to have to quarantine thereafter or follow the quarantine rules. And I saw some of the prices of the tickets that are for sale for this upcoming game. They're pretty expensive, considering all the quarantine requirements that you have. Probably best just for your own health and safety of your family to stay at home, root on the team, watch them get a big victory over the Chiefs this weekend. And then we are really going to be a very happy community as we go back to the Super Bowl. And I just want to congratulate the Pagulas, their entire organization, Brandon Beam, Coach McDermott, Josh Allen, and the rest of the players for bringing some joy this year to what has been an otherwise pretty dismal year. Good luck. Beat the Chiefs. Let's stampede Kansas City, and then go for the big one. Take care, everyone. Be safe and well. Wear your masks.